If you ever suffered from TMD, you know it's painful, the symptoms that come along with it.
The discomfort can often interrupt your overall quality of life and even make it tough to sleep at night. So what can you do to treat it?
Well, welcome Quality Dental Care, Dr. Jay Kotzian. Good to see you, doctor. Thanks for coming in.
Thank you for having me.
What is it, TMD? Because I'm familiar with TMJ, TMD. What is it, and how is that different?
So the difference, the TMJ is the actual joint that is disrupted or damaged when you do clenching and grinding. TMD is the disorder or the condition often associated with clenching and grinding of your teeth.
So what causes TMD? I mean, what are the symptoms of this?
So there are several causes of TMD. The biggest one is stress, life changes. So stress can cause clenching and grinding. There's even a genetic component. Oftentimes we'll see people where, you know, if your father does it, you may do it as well.
That's still one of the things they pass down, huh?
Yeah, amongst a lot of other good things as well.
Some other things too.
Some medications can cause the clenching and grinding often too. So oftentimes what will happen is a patient will present to our office complaining of either pain in the jaw or ringing even in the ear. Oftentimes it can even be associated with a toothache. So the symptoms or the reasons that I just listed can cause the clenching and grinding, which will lead to the pain in the joint, the teeth, and can even cause cracking and damage to the teeth. You can get significant wear to the teeth also.
And oftentimes people can suffer from this for years, can't they?
Absolutely. So many times people will try to, self-medicate. They'll try and use ibuprofen, different types of medications, until it gets to a point where they can no longer tolerate. So they'll present to our office, many times, having been in pain for a long time.
Well, I imagine some people just think it's going to go away by itself.
Right.
So what helps? Is it, I've seen mouth guards. Are mouth guards good to treat that?
Absolutely. So there are many different ways to treat. Typically, the most common is to start off with an occlusal guard. There are different types of occlusal guards, full coverage occlusal guards. Those are nice because they protect the teeth. They oftentimes will cover, and they have...
it's not very invasive. Look how small that thing is.
Yeah, it looks really small.
This one here is an NTI, so this is a different type of occlusal guard. This just covers the front teeth. So what this one is a little bit different than the full coverage occlusal guard. What this will do is actually try to retrain the brain. It'll prevent the patient's teeth from touching, so you won't get the wear, but it also helps retrain the brain so that the patients don't get back in that clenching or grinding habit. Where the full coverage occlusal guard, the one you see there on the screen, covers the entire teeth. Patients are still going to typically clench and grind when they wear this device, but this is more to protect the teeth, because oftentimes we'll see people come in and they've been clenching and grinding for a long period of time and they've worn their teeth down. They're now missing a lot of enamel off their teeth.
Now, is this something, I mean, are these just worn at night? Is this something that people are doing during the day under stress, or what would you say there?
So most often we have the patients wear these at night. Typically patients will do most of their clenching and grinding at night. Most often patients don't even realize they're doing it. So we do have them wear these at night. However, life is stressful throughout the day also, so we find that if people catch themselves clenching and grinding during the day, whether they're driving or sitting at the desk, the office, we will sometimes recommend that they wear that during the day also.
Yeah. Are there other treatment options besides guards? I've heard Botox can be used to treat it. Does that work?
Yeah, absolutely. So we'll typically start off with an occlusal guard. But many times patients will need to move on to a different type of treatment. What you see here on the screen is somebody getting a Botox injection. Many times people think of Botox as cosmetic, which obviously we do use it for cosmetic reasons. But what the Botox does is it relaxes or lessens the strength of the muscle. So there are four main muscles that will help close the jaw, leading to the clenching and grinding. Most often we'll put Botox in just one of the muscles, both the right and the left side. Sometimes we will do a couple different muscles. Essentially what it does is it just lessens the strength that the jaw is able to close. So again, you're doing less damage to the teeth in terms of wear, and then less damage to the joint also.
And with that Botox, is more than one treatment needed? Is that something that you need to come in, regularly for?
I appreciate you asking that question. So how Botox works is we tell patients that it typically won't take effect for about 3 to 4 days. You'll see maximum effect about week 2, after about 14 days. And so what we recommend patients is we'll follow up after 2 weeks just to see how they're doing. If we need to re-administer some more, we can. We don't re-administer any sooner than 3 months. What we'll find oftentimes is patients will come in, we'll give them Botox, and then, about the second week, they do see significant relief in their symptoms, their tooth pain, their jaw pain. Now, some patients can go a little longer than 3 months, but most often, about that 3-4 month window, we'll have patients come back and re-administer it. The one thing I would like to point out is we also do continue to have the patients wear their occlusal guards in conjunction with the
I was going to say,
Botox.
the guards are the first option.
Right,
That's the
that
first
is,
thing that
yes.
you try. Real quick, we got to get going as we look at the screen for Quality Dental Care right there on North 132nd Street. For people who are dealing with this at home, do you have any home remedies for them to try real quick?
I always tell people, ibuprofen, treat it like you would an ankle sprain or any type of other joint sprain. Ibuprofen, warm washcloths, cool washcloths, just to help with that joint. Now, if that doesn't help, then obviously seek out to your dentist and they can help you with further care.
All right, well, thanks, Doctor. QualityDentalCare.org.
And we saw those 2 locations. You're at the one on 132nd, though.
That is correct.
In Linden, yeah.
Well,
Doctor, thanks for
so
coming
much.
in.
We appreciate it.
Thank you.